So today we're going to speak to Becca Brady, our Business Unit Director and Storybrand Guide, to talk about everything to do with MedTech messaging, what goes right and what goes wrong, and how you can make your messaging hit home from today onwards. So Becca, let's start with the first question. So why do so many MedTech companies lead with features instead of outcomes?
I think it's mainly there's two main reasons. Firstly, teams have spent such a long time building this and they're really excited about their device and the features really excite them, especially when you have sort of engineers or product managers who start writing the messaging or the marketing and they can get really excited by the features. And then they're not talking about the outcomes, which is the bit that people really care about. The other part of that is I think it's really difficult to understand what the problem you solve is, and that's what links to your outcome. So if you are making it quicker in surgery or you're improving patient outcomes, it's all of that bit that people care about. However, I think people really focus on the how they do it versus what they actually get out of their device.
So just to clarify, what is the actual difference between a feature and an outcome? Can you give us an example of that?
Yes, so a feature is how a device does something. So the material that it's made out of, or all the specs are the features, and the outcome is what it actually gets you. So if we're talking about a stent, the feature is what the stent's made out of, how long it is, what the diameter of the stent is, whereas the benefit might be that it reduces stenosis. And that's the thing that matters.
Because that's what people are really looking for. They're not necessarily looking for the features, they're looking for the outcome it's going to deliver.
They don't necessarily care what the stent is made out of, as long as they know that it's biocompatible and it does what it needs to do. All of those things people kind of assume are a given. What they actually care about is it going to solve their problem, which for a stent could be stenosis.
Great. So from a sales perspective, what happens when you just lead with features?
People don't really care when you lead with features because they have to work out, does this solve the thing that I need it to solve? Like, is it solving my problem? And if they've got to work that out, they're never going to do that. It takes way too much brain time. You need to tell them, this is what this device is going to do for you. And your features kind of do that, but only if they will sit down and work out. Who has time for that?
And it's so busy in today's world as well. So if you're actually making people make a mental leap, they're just potentially not going to do it, is what you're saying.
They're never going to do it, no.
So that's going to impact your sense?
Of course, yes, most definitely.
Okay, so if people are leading at the moment with features and they want to move to outcomes, how do you actually rewrite a feature into an outcome?
So firstly, you work out what that feature is doing for the outcome. So let's use a stent example again. If you've got a different material that prevents stenosis, or at least prevent is a strong word, reduces stenosis, that's what you want to lead with. So each of your features is doing something. There's a reason that you've created it. There's a reason your engineers have spent time, you've done all the clinical testing on it. There's a reason that feature is there. It's talking about the why. So I think features, a really good example of a feature that people often talk about is that it comes in lots of different sizes and they'll stock there. But actually, going that step further about why that matters, because you have different sizes, you can use it on a wider variation of patients that have a different anatomies, and those different anatomies open up the population of where you can use this stent. That's the problem that it solves, that you've got difficult anatomy sometimes and the stents that you're currently using don't work in that anatomy because they're not the right size. So if you talk about that versus we have stents in a range of sizes, they have to make the jump. So I would take all of your features and be like, right, why did we create this feature? What problem did this feature solve? And that's what you lead with. The feature is sort of the support for what you're trying to solve versus the thing that you lead with.
Okay, so that was going to be my next question. Should all messaging just be outcome focused, or should you also include features in your messaging?
You should definitely include the features. I think people care about the features in the sense that it's the proof point. You know, MedTech is a very regulated industry. People need the data. They need to understand. You can't just say we do this, this, and this and call it a day. You do need to explain the how, but it's not leading with it. That's the important thing. So going back to the fact that you could use it in a wide range of patients, explaining that's because it comes in different diameters ranging from this to this, matters because that explains the how. Because once people understand you solve the problem, that's when they start asking the questions of how do you solve the problem. I think what MedTech makes a mistake of at the moment is we jump straight to this is how we solve your problem, and we haven't actually explained the bit beforehand of that this is what it does and here are the outcomes. We miss the first step and go straight to the second step. So they are important, it's just not what we should be leading with.
So really the top level is the outcome, and then under that is your supporting pillars, which could be your technical features, things like that, because as you say, they enable you to work in a larger array of patients or something like that.
Exactly, and a lot of the time, especially thinking about tenders, there are certain features that products need to have, and I think we can get really caught up on the fact, they're going to need to know this. And yes, they are going to need to know this. But is it the thing they need to know immediately? No. Is it a thing they need to know when they're a bit further along in their buyer's journey? They're at a more of a decision stage versus the awareness of, actually, I do have that problem, and yes, I do need that to be solved. So I think it's about making sure you put that feature messaging at the right time when people actually need it.
So Becca, if somebody's been listening to this and wants to fix their messaging stage that's more outcome focused, where do they start?
Well, they can go back and watch our 5-step formula video. So we go through it in lots of detail and really explain all the steps needed to move yourself from feature-led to outcome-led. But then what I would also do is I would take your top 3 features and really think about the so what behind those features. And then once you've done that, take that more outcome focused version and test it with people. Test it with KOLs, test it with other people, because sometimes you might really have it really clear in your head, but you have the curse of knowledge. You know what you're trying to say. And we do that here in Polymos. One account manager will read another account manager's work just to be like, does this, looking at it with fresh eyes, you can see that there's jumps. So all of that happens internally as well, and you should be doing it externally. And finally, you should be subscribing for more, because this channel has lots of videos, and we'll continuously have lots of videos on messaging and how to make sure you're always leading with the problem that you solve.
Okay, so Becca, what's coming up next week?
So next week, we have rewritten 3 MedTech brand messages, giving you the before and the after, and we've also done it for ourselves, just to show you exactly how this formula works and how you can put everything we spoke about today in practice.
Okay, well, thank you for your time today, and we will speak again very shortly.
Thanks, Claudia.